It's one of three.
Okay. And was that,
You can just hold it.
One.
Or you can just set this in your lap. Or
Okay. One was the Millis, one was the Folsom, and the one he ended up as the Willard Commission.
okay,
And on it, he had an outstanding Alabama physician, Julius Michelson from Foley, who had been president of the American Academy. President of the American Academy, not the state. Now, this was before Dr. Willard ever dreamed that he was going to end up in Tuscaloosa.
okay,
But he gained a good bit of notoriety for that study.
okay.
And the interesting thing about the study,
Is that what they call the Willard Report?
yeah,
Okay.
yeah. All three of these commissions, and most of them were conducted by academicians.
Okay,
See, that had been our headache before, is dealing with medical schools
right.
who didn't want to believe what we were trying to tell them, that they had to turn out primary care. We didn't use the term primary care then.
Okay,
But that's what it amounted to. We weren't even using the term family doctor then. Back then it was general practitioner, you see.
okay.
And they didn't like that one bit.
Medical schools didn't?
No, because they were interested in turning out specialists, subspecialists, and researchers, you see. Well, at any rate, this would have been sort of the very beginning. Well, the very beginning goes back further than that, but let's don't get confused about that.
Okay.
So this is why I'm asking, where do you want to start?
Well, if we can start there with the Willard Report, and
Well,
that was in the 1960s, right?
that was 66.
66. Okay.
Yeah. Well, that
And were you involved at that time with Dr. Willard? Or
no.
Okay.
That's why I said that he hadn't even thought about coming to Tuscaloosa at that time.
Okay.
He was thinking he was still at the University of Kentucky,
Right.
and he was thinking a whole lot about how to accomplish what his study said you need to do. I don't think I ended up saying. All three said that medical education was headed in the wrong direction.
Okay.
They were turning out what I just said, specialists, subspecialists, and researchers, and they weren't turning out the types of doctors to go out and treat people. Certainly not the masses of people.
Okay.
And that study, along with his other experiences, and Dr. Willard had very extensive experiences at Syracuse and Long Island and so on, was what convinced him that he wanted to pursue this type of thing, you know.
Okay.
Now, we had something that was worthwhile that happened on the local level. I said I'm almost reluctant to go back too far,
Okay.
but there was a stiff-necked dean in Birmingham who had just put everything out of commission that the Alabama Academy, known then as a general practice, had established, like preceptorships for medical students in rural areas or with general physician. He just put it out of commission. And on the local level, one of our medical students from I'm not sure when it began. They began calling it UAB. It probably was still the University of Alabama School of Medicine at that time.
Okay.
Do you have any idea who Lee Taylor is?
No.
Well, number one, he was our first student.
Okay.
Now, you understand, he came from Birmingham,
Okay.
but he's originally from Florence. He had been in the Navy. He was a mature gentleman, and he wanted a rural experience.
Okay.
And he went to some friends of ours on the faculty and told them what he wanted. And they thought it was a good idea, even though not one of them had any experience in rural family practice. So
Okay. And these were faculty at?
At the medical school.
Okay.
At the medical school.
In Tuscaloosa.
Let me give you a for instance. There was a Sarah Davis who was in the College of Pediatrics. There was a Sarah Finley who was in the Department of Pediatrics. There was a Ted Butterworth who was a hematologist.
Okay.
That sort of thing.
In Birmingham.
Birmingham,
Okay.
yeah.
Okay.
But they still could, partly I guess because we had known each other. Mm-hmm. And common sense said, you know, this fellow's got a good idea. And even though this stiff-necked dean, whose name I won't call,
Okay.
put us out of business,
Mm-hmm.
they knew that this sort of be happening. So sure enough, on the local level, he came to us
Okay.
as
Lee
a
Taylor.
Lee Taylor. Now he ended up with an illustrious background. He ended up on the faculty at UAB,
Oh, okay.
heading up the Department of Family Practice. He did the same thing at the University of South Alabama,
Okay.
and so on and so forth. But Lee got started with that. Now, the one thing, you only have to shoot me down because you know what you want better than I know what you want, you know?
Well, no, we just want to, we want this to be kind of more like a conversation. so-
Okay. Now, I was talking about 1966, okay?
Right.
Now, as far as I'm concerned, the earliest stages of our program in Tuscaloosa that could be termed a budding program started with David Matthews.
Okay.
And David, I haven't talked to him about this, but do you know where he's from? Grove Hill.
Okay. I knew it was somewhere in Alabama, but.
Yeah, Grove Hill, that's in southwest Alabama, about midway.
Okay.
And he knew from personal experience that small towns needed this sort of thing, you know?
Right.
And,
Family doctors.
well, I repeat,
General practice.
that's right. So he was already thinking about that when it became obvious that he was going to be the president.
Okay.
He, as I'm sure you know, he succeeded Frank Rose.
Right.
And the reason I'm fairly sure he was already thinking about it, I think he had already chatted briefly with John Burnham.
Okay.
Now,
okay.
you know John, of course.
Yes.
So those were the two who really began to think in terms of something for the University of Alabama.
Okay.
And it would have happened about 1968.
Okay.
I can't say precisely. I don't know what year Dr. Rose resigned and David took over. Do you know?
I don't know exactly.
It was 78 approximately. And so at first they just did things in an informal way.
Okay.
They dealt with the people in Birmingham.
Right.
They took trips like to Michigan State. They took trips to Montgomery to sort of size up the feeling.
To look at other programs.
That's right.
Okay.
That's right. And talk to people, you know, who could help them get this thing going. They, Dr. Matthews appointed a study commission of his own. I don't know what it's called, to tell you the
Okay.
truth.
Okay.
And I was not on it initially. I can tell you some names who were on it. Sid Alexander, does that name ring a bell?
That one doesn't.
He headed up the student health. What do they call it?
The Student Health Center?
Yeah,
Okay.
yeah. He headed that up. Another one was Dr. Moore, who was in the Department of Commerce. Another was Dr. Ira. Not Myers, baby. Ira. I got it down here.
Okay.
Anyway, he was head of the Department of Philosophy.
Oh, okay.
And
All at the University of Alabama.
that's right.
Okay.
And John was on there.
John
Burnham. Now, as the thing progressed, the reason John and I were close. His wife and Nancy sort of grew up together in Tuscaloosa.
Okay.
But he also was the doctor that I referred most of my internal medicine patients to.
Okay.
So we got to know each other professionally and also personally.
Okay.
And John said, here we're going to turn out, we think, generalist, call them whatever you like. And hopefully, for rural areas, we need somebody who would fill that role. So he, as a result of John suggesting it, David put me on it. So
on the commission.
Yeah, and one of the things I mentioned in this was that I found out, didn't know it was happening, that my lady over here, by the way, she's put up with me for 63 years, counting courting days, even more than that. So she deserves a lot more credit for patience than she gives herself, Anyway, she was keeping a diary on this that I did not know. But
I have the dates.
yeah, that's right.
That's great.
So it was March. I could give you the full date of '69
Okay.
that I attended my first meeting with this group.
Okay.
I tell you who else was on it at some point. Howard Gundy.
That name sounds familiar.
I'm not positive of this, but I think Dr. Gundy was a vice president.
I think so. And he knew Dr. Willard from Syracuse. Is that
That's right.
Is that what I'm
That's
remembering?
exactly
Okay.
right.
Okay.
He knew him there. He even knew him in Long Island when he was in public health.
Okay. Okay. So he was on the commission as well, or
On
Howard Gundy?
yeah, he was on this committee, whatever we called it.
Okay. And what was the first meeting like? Where was?
Well, now keep in mind, I was not with the first meeting.
Oh, okay.
The first
Your first
meeting,
meeting.
the first meeting I attended, I am almost sure, was at the University Club.
Okay. Okay.
Wasn't it, honey?
Yeah, it was there.
Okay.
I had dinner there.
Okay.
But the thing that began to become clearer and clearer is we didn't know what we were doing.
Okay. But y'all had a vision. it
Had a
sounds
vision, and the one thing that had been accomplished more by the relationship between John Burnham and Birmingham, and that would have included, no doubt, David, because he was a part and parcel. I told you they didn't have much use for people like me, generalists, but they did have a lot of respect for John Burnham for a number of reasons. First of all, he's brilliant. Secondly, he was a good internist, but he had a lot of knowledge, and he had some administrative abilities. He even filled in for the dean at one time.
Okay.
Joe Reeves, I believe his name was, but only briefly. Only I don't mean he was doing it. But anyway, we didn't know what we were doing. I started to say about the only thing that they had accomplished probably was to decide that if we had a program in Tuscaloosa, it should be in the clinical years, not the preclinical. Not. Do you follow me on this?
Yes.
Yes.
I'll repeat just for the sake of clarity. The first 2 years of medical school then, and it's changed somewhat, was devoted entirely to things like anatomy, neuroanatomy, physiology. You didn't deal with people, in other words.
Right.
You started dealing with folks the third and fourth years. So they convinced them that ought to be what we did, was the third and fourth years.
Okay.
But
and why was that? Why the decision to focus on the clinical years? Was that a good way to start the program? Or?
You'd have to start all over to put together an expert in how to carve up a cadaver, for example.
Right.
This type of thing. And they already had it in Birmingham.
Right, exactly. Mm-hmm.
Now, we had the hospital there, although
right.
Dr. Gundy would tell you in a hurry, you didn't have the doctors in that hospital. They were suspicious of it.
Oh, okay.
And if you're interested in knowing why that was, when the school was created in Birmingham, the hospital was the Jefferson Hilton Hospital. It's where I interned. It became the University Hospital. But in the process of its being turned into a teaching hospital, so many of the practicing physicians lost their staff privileges.
Oh, okay.
And the doctors in Tuscaloosa thought that was going to happen in Druid City.
Okay.
So that's why they had their guard up. Now, what do you do if you know vaguely what you want to do, but you don't know enough about what you don't know how to go about it?
Right.
So then I believe Dr. Gundy was the one who convinced the committee that Dr. Willard, he told them where Dr. Willard stood. You know, he told them about Syracuse. He told them about Long Island. He told them about the study. He told them about, and Dr. Willard had gained a considerable amount of notoriety with that study. As a matter of fact, he was recognized by the AMA and so on and so forth for that. And he knew one more important thing. Dr. Willard was going to have to give up his position as Dean of Kentucky because of age.
Right.
And I don't know how he felt about it at first, but it didn't take him long to get bored. And he wasn't at all happy. And he had too many things, dreams going around that weren't being accomplished. So I wrote in here, and I'm still convinced of what Dr. Gundy said and what somebody else had told me, that let's say somebody found out that Dr. Willard was in Texas looking for something to do.
Right, okay.
Hopefully along the lines of what he had been planning all this time. Now, Dr. Gundy and I think he did it one way. I know for a fact who was it? No, I think maybe Dr. Matthews thought that Mickey LeMayer, does that name ring a bell?
Yes. Charles LeMayer?
Yeah.
Yes.
That he was the one who somehow put Dr. Willard on to what we were doing, and it could have been done, and it really doesn't matter.
Right.
But the agreement was that, knowing vaguely what we were trying to do, he would stop off on his way back to Lexington in Tuscaloosa and see what was going on, you see. And when we got him there, I say we, no, this was before me. When John and Dr. Willard, Dr. Matthews got him there, they told him more about what was going to do, and he had the notion that he wanted to raise catfish.
Right.
Did you know that story?
Yes.
Well, they got the gentleman from Moundville, yeah. He was the banker, honey. What was his name?
Victor Poole?
Yeah. They got Victor to come up and talk to him about that. And Victor convinced him that Moundville would be a wonderful place to have that catfish farm.
Right.
So the combination of that and knowing what we wanted to do began to convince him.
Okay.
And the first time I ever met Dr. Willard was when they had a, as I remember, had a dinner for him.
Okay.
And that was early in '72. I think all these dates in here, if y'all want to take this and send the thing back to him. But at that particular dinner, we learned another thing about him. He was a great fan of Kentucky basketball.
Okay.
So knowing that, everybody had tickets to the Kentucky basketball, including me. So they let me go. But that was the very first beginning that I had with Dr. Willard.
Okay.
Now, so I've given you what is one way of putting the beginning. You see.
Right. Right.
Now you'll take it from there and ask me some questions or whatever.
That was interesting because I hadn't really heard a lot of that, the very beginnings, even before Dr. Willard was involved. So that was good to know and have on the record. So I suppose we could probably just continue from there. After Dr. Willard was convinced, what began to how did the college actually come into being and actually start and get rolling and all that sort of stuff?
I'm going to be a little fuzzy on my dates.
Sure.
But he came in May of that year, which I'm almost certain was, it had to be 71 or 72.
Okay.
Do you know what year he actually assumed the position as the dean?
I think it was 71.
Should have been 70. It might have been 71. It might have been late 71.
Well, he came in May.
Okay.
And he had several things he wanted to do. Obviously, he wanted to meet as many of the faculty
Right.
as possible.
So you first became involved with the committee in 1969.
Yeah, that was the planning committee.
The planning
See, that was before Dr. Willard was involved.
Okay.
But then after I met him, then I told you some of the things he wanted to do. He met the faculty. He wanted to meet some doctors in the area. He wanted to meet everybody is what it amounted to. Now, somebody, I asked if they knew Bobby Moore, and I don't think...
Is he the one from Commerce?
I'm sorry?
Is Bobby Moore the person from the Commerce?
No.
Okay.
No, that was another Moore.
Okay.
Yeah.
Okay.
Yeah. And I got his name in here. But, no, Bobby was... he was a biologist. He was in the Department of Biology.
Oh, okay.
And for some reason, Dr. Willard talked him into coming with him. And I can't tell you why, other than Bobby was energetic, he was bright, he obviously knew a lot of the faculty there. But he talked him into going with him entirely. He was the first professional that Dr. Willard employed.
Okay.
And he did a whole lot of things. Among those things, he helped to plan that Capstone Center. He also helped to plan the Willard Auditorium and that the tower, the education tower, connected with the. So I repeat, he did a whole lot of things. Okay. And Bobby and I got to know each other extremely well. Well, that was when I got to know Dr. Willard better. But because he came to Fayette.
Okay.
Obviously, somebody told him something about Fayette. And the fact that I had been connected with the university on that planning committee, the fact that I was a member of the American Academy of Family Physicians, and maybe some other things. One interesting thing, after things moved along and it looked like things were going to work out, suddenly it hit him. I'm not sure Dick has his boards, you know. And I could just see his face drop. And he said, by the way, do you have your boards? I said, of course I have. You could just see the relief, you know, on his face.
So when he came to Fayette, he came to visit with you?
Well, and to learn.
Okay.
And then when he realized I knew, when he got to know me, he asked me if I would help him to learn about other doctors in rural practice that he might recruit into the teaching program.
Okay.
And that's when he went to see people like Riley Lumpkin
Okay.
and, oh gosh, Moon Mullins. Does that name ring a bell?
Yes, it does.
Nice guy. Willis Israel, Leroy Holt, a lot of them. And an amusing thing, and I put that in here. For some reason, he told, honey, weren't you listening when he would come back and describe some of these people?
Oh, yeah. Pictures of what the people were like.
That's
He
right.
was not at all thrilled over what he would put down about us.
We didn't want to know. But he obviously had a very keen understanding of human nature.
Okay.
That was what came out. But we never asked him what he put on us.
Didn't want to know.
But that's how he got to know a lot of these people.
Okay, these rural physicians, because
Yeah.
they were practicing rural physicians.
That's right. That's right. And he was hoping out of some of them he was going to get some faculty, you see.
Because I guess at this point the college had been created, but he was still trying to build it, to get faculty and students.
Yeah, well, I can't tell you how he was putting it together. I can tell you how it came out to me. As time went along, and this was is a matter of months.
Okay.
He asked me if I could give some time to him. He might have asked me if I would join the faculty, and I said I can't do that.
Okay.
I said my town doesn't have enough medical help. There were 4 doctors here, and we were working pretty hard. But I said, let me talk to my colleagues, who all work together, by the way, and see how they feel about it. Well, when they realized what the whole idea was to turn out more doctors for more small towns, and our town too, and we benefited from it. They went along with the 2 days a week.
Okay.
And that was the beginning of my connection with him. Was to give up those 2 days.
Okay. So 2 days a week you were at the college teaching.
Well, helping him to get things going.
Oh, okay.
And some of it did involve teaching, but you see, we didn't have a resident until Armstrong came along, and I want to give this some sequence, but there were a lot of good things we could do. For example, it was January of the following year, whatever that was. It could have been 63 or 62, whichever. We flew to South Carolina.
Okay.
What's Charleston? I always get it's Charleston, South Carolina, isn't it?
There is a Charleston.
Well, anyway, we went to the University of South Carolina.
Okay.
Because they had a fellow named Hiram Curry there, who had been talked in. He was a neurologist, but he was the only faculty member at the University of South Carolina who had any general practice experience.
Oh, wow. Okay.
So they talked him into assuming chairmanship of this new department of general practice.
Okay.
Don't ask me what we called it at that time, but I think it was general practice at that time.
Okay.
Yeah, pretty sure it was. And so we learned a whole lot from Hiram. And they were just beginning to get into the computer business, that they were going to be able to keep up with the medications that patients took and all that business, you know.
Okay.
It turned out that they had a doctor up there, Louis Barnett, who had come from a little town maybe 25 miles from there.
Okay.
And became part of the faculty. And he and I hit it off. We were approximately the same age, and we'd done approximately the same sort of thing. And he helped us. He came to Tuscaloosa and spent several days helping us out. But this is the kind of thing I'm telling you that we were able to do.
Okay.
And then Dr. Willard asked me to go other places. So I went to Pennsylvania, trying to learn about Lancaster. They had a program. And I also went to Richmond.
Okay.
And not so much to study the college at the University of Richmond, but their connection with Blackstone. I believe it's Blackstone, sweetheart.
Okay.
Anyway, he took me out there, and nice guy, took me and showed me all their educational situation. And I said, "Where is your hospital?"
Uh-huh.
He said, "We don't have one."
Oh, wow.
I said, "You have a program and you don't have a hospital?" He said, "Let me remind you, the state of Virginia has a third of its counties without a hospital."
Okay.
Well, that was so different from Alabama.
Yeah.
See, Alabama had a hospital in every county except one.
Okay. Okay.
Coosa never did have one, I don't think. But so they had a place for a teaching program like that, and they did a great job too. Well, that's the kind of thing I'm talking about. We were able to do, even before you had even before you had students.
Right.
And I am almost certain we picked out a place to get our clinic started. E.C. Brock, name ring a bell?
Ernest Colebrock?
Ernest, yeah, that's right. He an orthopedist.
Yes, yes.
So he had either moved into another place or he was retired. I think he probably moved into another place. So we got, and that was our first clinic.
Okay.
Wow.
And
Did not know that.
No, I did not know that.
do you know where it is?
He recently gave a large gift to the college to start a lectureship on sports medicine. So he's been around. He comes in.
I just wondered if you knew where that place, where his.
No, I know where the place is.
It just a block or so from Druid City.
Okay.
It's in a little section that goes between between University Avenue and.
Okay, so I probably do know where. I know that area, but
Okay.
I don't know exactly. Yeah. I don't remember where that was.
That we use that
So that was
first.
the first clinical facility
Yeah.
for the college.
And that's where we taught Mark Armstrong when he came along. Now, what do you know about Mark? Do you know anything at all about Mark?
I really don't.
Our very first student.
You're right. He was your first. Was he the first resident?
I beg your pardon. First resident.
Okay.
I beg your pardon. Now, he was sort of a protege of the Owings, as you mentioned Bill, right?
Right.
Okay. When our Bill's daddy was a doctor.
Okay.
And I've forgotten the full story of how they got to know him. It had something to do with the service. But Mark came to this program,
Okay.
and we were lucky enough to get him. He came out of my school, Tulane.
Oh, okay.
But and so did the Owings, in case you didn't know.
Okay, I think
Both
I
father and son finished at
okay.
Tulane. And I think that was also another reason why they got to know Mark. But when Mark came to our program, in effect, he was being a guinea pig,
Right,
our very
that's right.
first. But he was willing to do it because he knew he was not going to stay there the full time.
Okay.
He was going down and join the Owings in Centerville.
I see. Okay.
And he stayed a little over 2 years.
Okay.
But he was a guinea pig. We broke in that little E.C. Brock's clinic and that type of thing. Now, all the while, of course, other things are going on, like, if you don't mind, sweetheart, please.
So did Mark go, after the 2.5 years, he went to Centerville?
Oh yeah,
Okay.
yeah. But then he went to Texas. Then he subsequently came back to Tuscaloosa.
That's right.
Casey. What, honey? Okay. Now I'm rattling, folks.
No, that's
Oh,
good.
no. A lot of this
Because
is
I
information we
didn't-
never heard.
I never knew that there was another facility before Capstone.
Yeah.
So,
Yeah.
that the college had.
Yeah.
So,
Well, I said other things were happening. Then Bobby, along about that time, had to be busy
right.
constructing that capstone.
Exactly.
Uh,
So was Mark he was the first resident? Was he the only resident?
he was the only one for a time.
Okay.
Now, I've got the dates on these things. And I told you that thanks to Lee Taylor, we had been established as a preceptorship
Okay.
for, first of all, obviously, for students, all of whom came from Birmingham. See? Now, Lee loved it. He loved it so much that he recruited 2 of his classmates, and then we had to send him on his way because he had talked these 2 boys into coming here, and so we had to take them. So, but he did work out something with Winfield, and went to Winfield and worked with them for a time.
Okay. So the college was then a preceptor? Is that how it worked?
Well, yeah, but it was sort of a loose relationship at first, but it began to fall together. Now another preceptorship was at Foley, and I had mentioned this Julius Michelson. Do you remember when I mentioned Julius?
Yes.
He was on the committee, the study commission that Dr. Willard had.
Right.
Okay, and as I said, a very outstanding fellow. Had been president of the American Academy of American Academy of General Practice. It was back in those days.
Okay.
But he was very outstanding. Well, they also took on preceptors,
And
preceptees.
And he was in Foley.
He was in Foley.
Okay.
But Dr. Peter Peacock, I bet you don't know that name, do you? Isn't that a nice
It
name?
is.
And his wife, isn't she still in Tuscaloosa?
Yeah, she's still an anesthesiologist.
I don't know that she's practiced her
Dorothy Peacock.
Peacock.
Okay.
But anyway, at the time, Peter was on the faculty in Birmingham.
Okay.
He was in public health, and they also had him wear the hat of looking after the students. What he thought he had this nice guy lined up for Foley.
Okay.
And Mike Michelson, Julius Michelson and Foley phoned him and said, "I'm sorry." He said, "We've just recruited a doctor for our own clinic," and said, "We've got to use the space that we would have let the student have for this man, so we can't use him." So Peter called me, and he said, "Can you take this young man?" And I said, "Sure, we'll be glad to have him." Turns out to be Mike McBurty.
Okay. Interesting. And you have him now, still.
Yes, we got him in the family.
Exactly.
Well, I love to tell this story because it's true. When he came to there as a student, he and my daughter, who had finished at the university and gotten a master's in education and was doing some teaching, they didn't like each other.
Hated each other.
Well, I don't know they went that far
Well, they
anyway.
did.
He
I'll
thought,
never marry a doctor.
well, she thought,
I wouldn't marry a spoiled doctor's daughter.
well, that's the way it turned out. He thought that she was a spoiled doctor's daughter, and he thought that he was a cocky medical student. So they didn't hit it off. And
That's funny.
but we had a great time. He was an excellent student. He stayed with us about two months.
Okay.
And I love that. We'd find him a place to stay, but they worked their pants off. Believe me.
Okay.
Now let's see where I can take this.
So Mike was with your practice for
as a student.
As a student.
As a
But he
student.
was here every Saturday night to eat dinner.
Okay.
Yeah, well, yeah, we did that with, honey. That you know, I think we're talking about a different group. We
No,
won't
that's
get.
another group.
Okay.
Yeah, but we love to entertain them
We
anyway,
have
and they love to
We
eat
have
naturally.
residents constantly.
But what can I go from there now?
So it sounds like at this point, were you still spending 2 days a week in Tuscaloosa, or had you finished that work and then you were here
I was still,
working with students?
yeah, I was still connected with and what happened was we hadn't gone far enough that when Mike graduated, he could come with us.
Okay.
And he asked me. I said, Mike, we simply aren't ready.
Okay.
And so he went to Oklahoma.
Uh-huh.
And he stayed a year.
Okay.
And then he called me again. He said, are you ready? I said, yep, we're ready for you now.
Okay.
So he was the first full graduate of residency. Now, Mark didn't finish. Mark just had a little more than 2 years. But Mike came in and had the full, with what he already had and what we were able to give him. He had 3 years that allowed him to finish his residency. So that's why he is given credit for being the first graduate. And then there was another fellow named Ted Simmons, I believe his name was, who was right on his coattails. I mean, by that he came not too long after. But again, that name is down here. He came, and then we began to get a little reputation.
Okay. Okay.
And it's amazing the quality of the boys we got who came with that program.
Okay.
When they had no more to go on than what we put together. But all the while, now Dr. Willard was recruiting like a madman.
Okay.
And
what was it that they saw about the program that because it was still a new program and
well, let me again, if you take the time to read this, it'll fall together a little bit better.
Okay.
Now, do you know John Packard?
I've seen the name.
Okay. Now let me tell you who John was.
Okay.
John was a cardiologist in Pensacola.
Okay.
Now he came to Birmingham with some federal program. It was a regional medical this, that, and the other. But he also got on the faculty of UAB. And I just happened to meet him one day when I was up there, and we just struck up a conversation. And as this program evolved, I mentioned him to Dr. Willard, and he began to look better and better to Dr. Willard as somebody we might be interested in. But at first, we didn't have enough to attract John. One fellow that he was able to attract was a guy by the name of Bill Hubbard. Now, do you remember that name? I think it's Hubbard, not like our Hubbert here in Fayette.
Okay.
Hubbard, well qualified. He had all the credentials, everything that I had, plus he had had experience as a director of a residency in Jacksonville, Florida. I think I'm right about that. But again, Dr. Willard's name helped us on a lot of these things. After all, this man was famous.
Right.
And so he recruited Bill. And the best thing that Bill did, he put everything together so that we could apply for certification as a residency. Now, Dr. Willard was extremely miffed because Huntsville beat us to it.
Okay.
But when Huntsville did it, the guy who did it had taught Mike in Oklahoma. So they recruited him to Huntsville, And he did it without anything to show. He didn't have anything, and Dr. Willard was too proud to apply without having something to show. Not necessarily a resident, but at least your program.
Right, right.
So this guy in Huntsville, he didn't let that stand in his. But it really got away with Dr. Willard about that. But anyway, John came. We got him to come to Fayette, come to Tuscaloosa,
Okay.
and he, Dr. Willard, talked to him about all kinds of things. He talked to him about faculty, and he talked to him about buildings, and he talked to him about all kinds of things, just to let him know that here's what we're getting, what we're developing. And I'm sure it began to look a little better to Dr. Packard. 3 or 4 things happened, bing, bing, bing. But one of the bad things that happened, after we were rocking along, Dr. Willard turns up with cancer of the stomach. Did you know that?
I didn't know that.
You didn't know that? Well, obviously, his associates didn't know that. If we had, we would have made him do something about it sooner.
Right.
But he always looked run down. Did y'all ever know him?
No.
You would, didn't. If you saw pictures, you'd know.
Pictures, but
Long.
not many pictures, just a few.
Long and lean.
Right.
Never stopped smoking.
Oh, okay.
I think he was a pretty good cougher, too. So we weren't surprised that he had something.
Right.
But boy, when we found out he had cancer of the stomach,
Yeah.
that really jolted us. And that could have run the whole program.
Right.
You lose your star attraction. The man who's had all the experience, and you're up a creek.
Right.
Well, the only thing that made us feel a little better, Dr. Packard accepted the position as associate dean or vice dean or whatever the number 2 man was, you see. Now, I don't think that is what convinced John to do it. In other words, I don't think John was looking for the position as dean. I think he had just convinced himself that there was something here.
Right.
So he came in that position.
And do you remember what year this was?
I've got him here,
Oh,
sweetheart.
okay.
I've got him here. But so much happened in such a short time. And I'll give you a for instance there. Dr. Willard had made plans. Our leading civic organization at the time here was Exchange Club. And he had planned to come talk to the Exchange Club on my behalf.
Okay.
And I put it that way. He wanted to explain why the people in Fayette, they might be reluctant to give up, when they were short of doctors anyway, to give up any doctor's time. But if his dreams came true, then Fayette and a lot of other small towns are going to benefit.
Right.
And so that's why he was supposed to come. Well, this surgery interrupted him.
Okay.
But he was so convinced that he was going to do that a month and 2 days after he had his surgery, he was at the Exchange Club
Okay.
telling me that.
Wow.
So we've got some more. Another thing I haven't pointed out is that almost everybody they were going to recruit, they would bring them to Fayette.
Okay.
Now, it's not that Fayette is the world's #1 attraction. We know better than that. But we had a good group of 4 doctors who were succeeding in doing the sort of thing Dr. Willard wanted to do.
Right.
So he would send them up here. No, I can't tell you a story. But no, it sounds not so good. But anyway, among other people he bought were the Peronis.
Okay.
And of course, you were trying to recruit them. And he wasn't, Peroni wasn't at all sure he wanted this redneck place, you know.
That's right. He was from Boston. Is that right?
Yeah, he was from Boston, but he went to school at Hershey, I'm pretty sure.
Okay.
But now I say I'm pretty sure. Am I right or wrong?
I think you're right.
Yeah. But he was from Boston, you're
Yeah,
right.
he was a very Bostonian.
And but anyway, and
Dorothy.
Dorothy, yeah.
Oh.
They brought him up, and I will tell you this. He didn't know there was any such thing as barbecue pork and that sort of thing. All he knew was barbecue chicken. So John educated him, took him out to one of our residents, and showed him what that was about. But that's what I'm talking about.
Okay.
When I actually the second doctor after Dr. Packard was our pediatrician. Heffelfinger, yeah.
Okay.
Yeah, he was the second.
Okay.
And he also came from that general area, from it might have been Pensacola.
Okay.
Don't hold me to that, but it was like that. How do you remember?
It was Florida.
Yeah. And he'd bring them all up here. Or somebody would bring them up here. Have you ever heard of the Maisie Blanks? Does that mean anything at all?
No.
Oh, she was marvelous.
She was worth knowing. She was one of the cutest things I've ever seen. She bounced all over. And somebody brought her up here. I've forgotten who it was. Bobby Moore was the one who brought her up here.
She was the secretary for the college?
Yeah. She was sort of his personal social secretary, Dr. Willard.
Okay.
But she was so outgoing and so cute. She was a small town Mississippian.
Okay.
And you know how they can be. And anyway, she planned all the social affairs and this type, and ended up as a headhunter, a recruiter. But and she got some doctors for us, by the way, here. But I'm digressing. But anyway, that again is the sort of thing I'm saying. Well, now I told you about Bill Hubbard, didn't I?
Yes.
Well, wouldn't you know, he didn't hit it off. He didn't hit it off with another member of the faculty. Let's say, I won't call names, but I'll say somebody senior to him.
Okay.
And he knew that he would be knuckling under to somebody he didn't get along with. And he left.
Okay.
And again, that just, and I cannot remember whether it was before or after. Seems to me that was before we knew Dr. Willard had his. No, it couldn't have been, because no, this was after. But anyway, that left Dr. Willard in a pickle. And he asked me if I would take that position.
Okay.
And I said, Dr. Willard, I can't do it. Again, I've got my responsibilities in Fayette. But I'll become the interim.
Okay.
Until you can find somebody to take the place. And I stayed in that position something over a year.
Okay. And that was interim?
Head of the residency. That was what Hubbard was supposed to do.
Okay.
And I'm leaving out some things,
So
folks.
you did that for about a year?
A little over a year.
Okay.
And then I convinced myself that I would not become a full-time academician. That's not my cup of tea. I wanted to come right here.
Come here and practice.
I continued to be a preceptor,
Okay.
and so I maintained my contact. But and it was sometime in there, by the way, that Dr. Winternitz came, because he didn't come before I left there. I'm positive of that in my mind. You didn't get to know him well at all, did you, honey?
No.
Winternitz. But we had a lot of other people that you'll see and hear. We had a nice guy who headed up our OB department, and I told you about Pernilla held down the medicine until Dr. Winonitz came.
Okay.
And we had you can't remember what the man who, he and his wife both were very outgoing people, who headed up our OB. He ended up going to Birmingham and being very important up there. But we were accumulating a good bunch of folks. Mm-hmm. And I think I told you that Mike had come back.
Mm-hmm. And these people that you all were accumulating, they wanted to come here because of the program that we had, and because of Dr. Willard and the things
That's
that
right.
we were doing here.
That's
Okay.
exactly right. And
because some of them weren't general practitioners. Like I think Dr. Peroni was an internist.
No.
Dr.
These were people we were trying to recruit into the residency.
Okay. Mm-hmm.
All they knew was that they wanted to be primary care, if you want to put it that way. But I think we were probably using the term family physicians at that time. I can't tell you that for sure.
Okay.
But do you happen to know who Nick Knight is?
Yes. Mm-hmm.
Oh, good.
Yes, he's in Selma.
That's exactly right. Nick was one of the perfect examples of the ones that I'm talking about. He was excellent. Mm-hmm. And but we had, we had so many of these guys. Wayne Peters, who ended up in Arab, honey.
Okay.
Is that where he is?
Okay.
Uh,
So you all were attracting a lot of people to the residence.
that's right.
Mm-hmm.
That's right.
But they would come up here in the precinct.
Okay.
Yeah.
Okay.
And I tell you another one that it just ran through my head and I lost him. Oh gosh. But a lot of them, and there were more than, we were even attracting them from out of state.
Okay.
We got some very fine ones from Mississippi.
Mm-hmm.
We got some from Louisiana. That's how we got Rick.
Okay. Okay.
Now Rick never did spend any time in Fayette.
Okay.
I think he knew. I'm sure he knew about us, but he never did spend any time. And we even got some from Texas.
Okay.
Interestingly, Nick I've kept in touch with.
Mm-hmm.
I'll pull this out. Somewhere along there, I told you about Dr. Willard trying to recruit from practicing physicians.
Mm-hmm.
He talked Riley Lumpkin into
Okay.
coming. Now he wasn't responsible for Bill DeShazo,
Okay.
because Bill came to Tuscaloosa
Right.
to work with the
Student health.
probably the student health, but also he was one of the doctors for the football team.
That's right.
when Bear was there. Mm-hmm. They were like Mutt and Jeff, big old Bear and little Billy
That's
Bill.
right.
Both of them puffing away as they walked right, you know.
Okay.
Let me get you all something to drink or whatever.
We have Cokes and water and tea and what else? We had 4 things.
Strawberry
strawberry
lemonade.
lemonade.
Does any of this sound,
Nothing.
y'all all right? Okay. Would you like to have a bottle of water?
Actually, I'll take some tea. Tea sounds good, but I can't. Mm-hmm.
Oh, I'll get it.
No, it's this Crystal Light.
Yeah, that sounds
It's all
perfect.
mixed up.
That's
All right.
Okay.
All right.
You
Okay.
don't have to make anything. Okay.
Now Bill came for that purpose, and Dr. Willard talked him into coming with the department.
Okay.
And Bill, I'm almost certain, took my place.
Okay.
I think Bill became head of the residency right after I left. Because I've heard Nick talk about, he said he could sell ice to Eskimos or some such thing. And he made it a point of keeping up with all of his boys. He'd follow them after they went out into their practice and that sort of thing.
Mm-hmm.
So
Okay.
I'm sure I'm leaving out some important things. So can you think of anything?
No, I think that really did fill in a lot of, for me at least, for me personally, a lot of gaps of information that I didn't know. So that was good.
I will tell you one other thing you wanted to know. You know, what was I doing? Mm-hmm. He asked me to serve on the admissions committee.
This is Dr. Willard?
Dr. Willard.
Okay.
Use one of the days on the admissions committee in Birmingham.
Okay.
Because he wanted somebody in his program. And the idea, of course, was to try to select some boys who might lean toward what we were trying to do.
Right.
And I'm sure I tried to influence.
How was that, though, up in Birmingham when you serving on that admissions?
They were respectful.
Okay.
But you could see why they leaned in the direction that they did. The thing was heavy with basic science people.
Right.
Not clinicians, but basic science people. And you know they're going to lean toward researchers and that type of thing.
Right.
So I was able to change that around just a tad, you know. Another thing, he would send us, Bobby Moore and I went to Kansas City once. Because he knew how important the American Academy of General Practice was then.
Okay.
And he wanted to establish any relationship he could with them. So,
Okay.
and he got word about this behavioral medicine.
Okay.
And he didn't know, Dr. Willard was not a clinician. That's what he was not. But he thought there was something to this behavioral medicine. So he sent Bobby and me up there to get the feel of what was going on. Kansas City, the reason for that was the headquarters of the American Academy. See?
Right.
And so, but after I listened to very few lectures on this behavioral medicine, it was nothing in the world but what a country doctor practiced anyway. You know, you got to know your patients, and the better you know your patients, the more you know about them and their families, and you name it. You see.
Right.
So anyway, I told Bobby, and Bobby reminded me that later on. When I wrote this thing, I called my buddies, some of my buddies. I called Bobby, and I called Dr. Gundy, and I called John, and I called Dr. Matthews, and Mike. Those were the 5 people that I talked to about 30 minutes.
Okay.
And Bobby reminded me about that trip.
Kansas City.
Yeah. Okay, I think I've said enough.
Okay. And I just wanted to go back to when you were on the planning committee, even before the college was formed. What was that like? What were those discussions like? I mean, you all were creating something brand new for Tuscaloosa.
Well, we knew what we wanted. Vaguely.
Okay. Were most people in agreement? Was there consensus, or was there?
Well, you keep in mind the people we had on there. We have a man from commerce. We have a man from philosophy.
Right. Right.
So you know they were brand new at this business. But people like Dr. Burnham,
right,
had a better feel. Dr. Gundy had a better feel than some of the others. Certainly, Dr. Matthews knew something. I told you from Grove Hill, and he was very fond of his family doctor. And but I told it to you right. We were spinning our wheels. We were getting nowhere. We met regularly, but we weren't getting anywhere.
Okay.
And we knew we had to do more.
Okay.
And then Dr. Gundy was the one who put us on the right track.
Okay. By getting Dr. Willard.
That's right. He knew enough about Dr. Willard. He knew his background, and he knew all he had done at Kentucky. He did a lot of marvelous things at Kentucky, and he knew he had to retire. So with all this, we had a nibble.
Right.
I haven't said enough about John Burnham. Are you interested?
Yes.
Yes. definitely.
John is a brilliant guy. He was, in case you don't know, he was the stepson of Paul Burnham, who was a famous assistant coach at Alabama.
Oh, I didn't know that.
Yeah. He had his first 2 years, as all of them did back in those days, in Tuscaloosa. In Tuscaloosa. And then he went to Harvard.
Okay.
And he realized what he wanted to do, and he had his, I think he took all of his residency at Duke, didn't he, honey?
At Duke?
Yeah, that's where Celeste had one of her babies, wasn't it?
Yeah.
Yeah. And then he came back and went into practice. But I told you that with this background and with his specialty, he had a special place with the people in Birmingham.
Right.
John became very close with Dr. Matthews. And I don't know why exactly they hit it off. For all I know, he was Dr. Matthews' doctor. He could very well have been.
Okay.
But he liked this dream. But his thoughts were, first of all, he was the one who pushed on making it the clinical years.
Okay.
But he really would have preferred that the residency be in internal medicine, his specialty.
That was, okay.
But John was smart enough to realize that Druid City did not have the underpinnings for that.
Right.
You know, they didn't have the hematologists back in those days, the endocrinologists, and so on and so on and so on. On the other hand, he felt that they did have the underpinnings for a general type of family practice type of thing. So he went along with the idea completely. He told me this, that they asked him if he would take the deanship.
Oh, okay.
And he said no. He said he didn't think that was the thing for him. Although he's a pretty good administrator. But when Dr. Willard, we started after him, John did everything he could to recruit him.
Okay.
And he did everything he could to help out with this program. And he was sharp. He was a good speaker in the sense that he could be a pretty good comedian.
Oh, okay.
For example, he loved, I don't know how, I used to give him and some of my other buddies at Tuscaloosa fits because they all walked around like they were looking down at the world, you know. He and his two partners were just like that, all three of them just like up here, looking. Max Moody was one, and Omar Baker was the other. And I said, I don't know how you can deal with people, John, with this nose in the air sort of thing, but he did nevertheless. And he got a kick out of some of the expressions that they made, and he would make little notes. And he ended up writing an article for the New England Journal of Medicine. You know, that is the journal on that very subject, and they published it.
I've read that article.
Have you?
Yeah, Dr. Stryker or somebody sent it around a few months ago.
Yeah. I think that's wonderful because I love that article.
Well, we had a I forget what we called it, art of medicine. But basically, we gathered in the library, and Celeste Burnham came in, and actually we talked about Dr. Burnham for an hour or so. So we've had some stories.
Well, we still stay in touch with Celeste. We talked with her. How long ago? Hadn't been long ago. Not long ago. Anyway, we love them both. But John did everything he could to get it going, and he did everything he could to support it. And then, as you well know, and you know more about this than I did, he came back, and he did a lot then. So.
And I've heard that the students really loved him.
Well, he was such a darn good teacher. He was such a good. I shouldn't say this because probably your doctor does this, but it drives us old folks crazy to listen to somebody's chest without taking the clothes off, you know.
Okay.
And these days they listen right through that thing, and John would give them fits about that. That part of the reasons they do that, they can get away with it because they use so much imaging, you know, X-rays and you name it.
Mm-hmm. Lots of tests. So.
What have I missed, sweetie?
Well, how about your background, your medical training and all that sort of stuff? Just it can just be in general, broad terms, whatever you'd like to talk about, but just so we have an idea.
How you became interested in medicine and.
I don't know that y'all want to hear all this, but I'll start and you stop me.
Okay.
I grew up in Eufaula, and when I was 4 years old, I had diphtheria, and my family doctor was Dr. Paul Salter. Does that name ring a bell for you? The reason I'm asking that, he had a son and a grandson who were surgeons in Birmingham at the medical school,
Okay.
and his wife, the son, who was about my age, married a nice woman who was an X-ray lady with that big group in Tuscaloosa.
Okay.
So anyway, I thought you might know him through that. Anyway, he had nice little ways of getting along with his little people, and he gave me a silver dollar. And I thought that was wonderful. You know? I didn't know what a silver dollar was, but it sure looked good. And I thought, how nice. I think I'll grow up and do that same. Anyway, I was about 4 when I knew I was going to study medicine, and nothing could have changed me. I said he was my mentor and he was my hero. He went to Tulane, and that was why I was interested in Tulane.
Okay.
And he was a great GP surgeon, and that was the type of thing I was leaning toward. Well, I also thought I was a high school athlete. I just thought it, but anyway, about the 11th grade, some professors at Auburn came, and they didn't say when you fellows are drafted. No, they didn't say if you were drafted. They said when you were drafted. They said, our advice to you is get as much education as you can now.
Okay.
And only reason I brought up that sports business, my coach tried to talk me out of it, but I had enough maturity, and my folks left it to me entirely. I had enough maturity to know I wanted to go ahead. I was determined to be that doctor. I didn't give a second thought to Auburn, even though Eufaula and Auburn are close together, because back in those days, you thought more of Alabama as being the pre-med school, Auburn more toward the agricultural type of thing. So anyway, I went to Tuscaloosa, and you all may or may not know this, and it may not be the same these days. It took 16 credits to graduate from high school, to get a high school diploma, but only 15 to get into college.
Okay.
And I got 2 credits by going to City High, and that's where I met the lady here. We had an English course under Miss Brown at Tuscaloosa City High.
Okay.
And then Granny Gray, who was an institution there, she had taught mathematics forever. And by the time I was there, she was strictly a tutor. So she took me under her wing and taught me enough that I was able to pass an entrance exam. So then I get my 15 credits, and I'm in pre-med. And one day I was asked by a friend, "Are you going to take this officer's training course examination?" I said, "What's this all about?" He said, "Well, if you pass that, then you'll get into they'll put you into some sort of officer's training school." And I said, "Do I really want that?" He said, "Well, don't you want to continue your education?" I said, "Well, that sounds pretty good." And passed the thing. And I won't tell you how I almost screwed up, but I did. I just barely made it in the sense of getting it signed like it should have been by my parents to give them the credit to go ahead and do it. Anyway, I was put in the Navy V-12 program.
Okay.
And I was sent to Duke, which is a good place to be, obviously, in the Navy V-12 program to continue my pre-med.
Okay.
And Duke was a very young medical school. This was in the early 40s. And Duke's medical school started in the mid 30s. On the other hand, Tulane had been there since 1834. Besides, I knew that's the only place I wanted to go. But I managed to get the grades there that there were 5 of us who were able to call our shots and got the medical school we wanted. And obviously that's where I went to Tulane. And now they were rushing you there. And altogether, I had only 2+ years of pre-med instead of the 4 that I guess they have these days. But once you hit medical school, no rushing.
Right.
So I had the full 4 years.
Okay.
Now the first part of it, I was in the Navy, and the war ended.
Okay.
And then, and fortunately, my folks had some luck from a financial standpoint. And fortunately, they were able to pick up the cost. Any private school, I don't have to tell you this, a medical school, it cost. So anyway, I finished Tulane. And then I came back to Birmingham. I told you that part.
Right.
The Jefferson Hillman Hospital, which is forerunner of the University Hospital. And now, did I answer your question?
Yeah, I think so. Yeah.
Okay.
Anyway,
that's why I stuck with it.
Yeah.
No, let me tell you a little bit more. Now, Nancy and I had gotten to know each other, and I told you. And I found out she was a tornado from Texas. I was walking along the sidewalk minding my business, and here comes this little thing on her bike with her skirts just flying, and it ran me off the sidewalk, you know. But in spite of that, we courted a little bit in pre-med. But then when I was in my internship, her uncle was an internationally renowned physician who was a nutritionist, and she worked for him at the old Hillman. You ever hear of the old Hillman? I said Jefferson Hillman.
Right.
Well, the Hillman was there first.
Okay.
Was he on the 4th or 5th floor, Betty?
5th floor.
5th floor.
It was the part that connected with the Jefferson, so all of the interns had to go from
Okay.
emergency room through there. And of course, I managed to sit at the back in the lab where they were going through.
Okay.
It was very easy.
Well, we met again. Let's put it that way. And we picked the toughest. First of all, the whole year was tough. The reason was that they had openings for 21 interns,
Okay.
and they had only 10, so we had to do double duty. So when you were on obstetrics, you actually were doing the work of 2 people, and the hours were killing. But it was also the time that we got word, this was Korean wartime, that you're going to be called up.
Okay.
The bad thing was you were hustling around trying to get everything in the world done. The good thing was they immediately started paying you, so that you were able to do some things you couldn't otherwise.
Okay.
So Nancy and I were able then to think in terms of getting married,
Okay.
and that's when we got married.
He was on 2 days, 2 nights a week, and off 1. So we had trouble trying to find an afternoon when we could get married. But we did.
My gosh.
Yeah.
Had to work around the schedule.
Then I'll try to rush through this. We were assigned to Key West, and naive people we said that would be wonderful. We'll come home on the weekends. Take a look at the map. You're closer to New York City than you are. We didn't come home on weekends, but anyway, we had a wonderful. It was a submarine base down there, and we had a great time. And our first child was born down there.
Okay.
And wouldn't you know? I was assigned. I was given my assignment to leave just about the time she was going to have the baby. But we by that time we'd made a lot of good contacts. That was Truman's Camp David. He used to come down there all the time.
Okay.
And so we got to know some very important people. And when we told them our dilemma, they told us how to handle it. So I flew to Washington and got it changed. And that's right. How about that?
Wow, that's fast.
Go up there and get it changed, and back in Key West that same night.
That's incredible. That's amazing.
And so then we were put in the Pacific, and that's where I spent a year. And again, we had a wonderful assignment there. Our ship was in dry dock at Pearl Harbor. So anyway, we spent that year, and then we had a year of GP residency in Bakersfield, California. Didn't I mention that to one of you?
You did.
Yeah.
To Brett.
I hate to tell you, we didn't like that place. And I'll tell you some reasons we didn't like that place. Number one, it rained one time.
Yeah.
But we had earthquakes coming out, which destroyed 3 of the 4 wings of our hospital.
Wow.
Oh, okay.
So we spent the rest of the year in that one wing plus temporary facilities. Then we went to Colorado, and somebody knew. Did you know that Sean? He's doing pretty much the same type of thing I did.
Okay.
Yeah. So isn't that a nice coincidence?
That is.
And so I had the year of that, and then I came back, and I had wanted to get some additional surgery training while I was in Denver. And the way they did it was to send you out with, say, a 3rd or 4th year surgery resident to an Indian reservation. And you could learn from the surgeon. He would, you had your one-to-one mentor. But my dad became in bad health, so I had to come back to Alabama, and then got a certain amount worked out. But I ran into an old friend who told me how badly Fayette needed doctors, and that we had an excellent surgeon here. He said, "Now why don't you just go work with him?" That's what we did.
Okay.
Maybe I answered that question.
Yeah, that does. Yeah.
Going around the block to do it. But I never gave up the idea of spending all my days in a small town, and that's why I didn't go into academic medicine.
Okay, so that was something you always wanted to do, was medicine.
I grew up with it, and I'm not sure you all counted on all this.
Oh, no, it's great.
No, definitely, it is.
Okay. And I just have one more question.
Okay.
Since you were there at the beginnings of the college, even before, a little bit before it was founded, and you've been involved with it all these years, what do you think, based on what you all had envisioned at the start and where the college is today? Are you pleased with how things turned out in the college?
Yeah, I am indeed. As far as what the college has done, there is one disappointment. Everybody does not appreciate the primary care doctor enough. Most people don't. Let me tell you what I'm talking about. They are willing to go to a proceduralist, if you want to put it that way. Let's say an eye specialist to take out cataracts, or doctor to take out tonsils and adenoids or whatever. If it involves a procedure,
right.
they're willing to pay through the nose. Mm-hmm. They are not willing to pay that primary care doctor to think mm-hmm. and to plan the course of your treatment and illness. They haven't reached that. Now they're reaching it. Mm-hmm. In case you all don't know, I've been reading recently. They're giving bonuses for this, that, and the other because they've suddenly awakened to the fact that that's what the country still needs is people to go out and treat people, you know.
Right.
But that's my one disappointment, honey. Mm-hmm. But as far as what the college is doing, I'm really thrilled to death about Rick. Mm-hmm. Did we talk about Rick at all?
Not really. Just not really. Mm-mm.
Well, let me tell you a little bit about Rick. Mm-hmm. Rick is a New Orleanian. Right. I'm almost sure I'm right about that. Mm-hmm. He went to undergraduate at Tulane. If I had been in his shoes, as much as I love Tulane, if I had lived in New Orleans, and who is Louisiana?
Me.
You are? Okay, well, you can understand this. Because of the cost, I would have gone to LSU.
Right, right.
Because the tuition is much, much less.
Mm-hmm, mm-hmm.
But, and he did, and then he came to Tuscaloosa. I think we've been through that.
Right. Mm-hmm.
What got him. But then he had his couple of years in a small town in Mississippi. Mm-hmm. Mm-hmm. And then he got into the academic thing. He was in Colorado too for some reason.
Right.
I lost track of that.
Mm-hmm.
But and he knew something about Fayette, but he never spent time in Fayette. Mm-hmm. But I got to know him. Tulane got wind of him. Tulane surprised me. Years ago, there was a national meeting of the American Academy in New Orleans. Mm-hmm. And we got an invitation to one of the fancy restaurants down there. And the head of the Department of Medicine spoke to us.
Okay.
And he said, we are in the process, in effect, he was saying, of developing a primary care type of program.
Okay. Mm-hmm.
And I didn't believe it.
Right.
And I tell you, Bill Owens, as I told you, Bill and his daughter, I think she's Tulane too.
Okay.
They were there,
Yeah.
and they didn't believe it either.
Right.
Because Tulane had been like Duke, Vandy, Emory, and so on. Mm-hmm. Academic, research, subspecial, all that business. Mm-hmm. So I really didn't think they'd do it, but they did it.
That's right.
And that's why they got Rick.
Right.
Mm-hmm.
They knew of his background, so they recruited him down there. And that's when I began to see him. When we went back for our class reunions every 4 or 5 years, mm-hmm. We'd go by and see him. So I began to keep up with him. So I was thrilled to death that they got him.
Right.
My buddy Margaret Garner, I'll guarantee you, she's thrilled to death too.
Well, she was on the search committee. So.
Well, she I think she tipped off Rick that the position was going to be available.
She probably did.
And but I can't look at her without calling her Pipkin. Did you remember her maiden name was Pipkin?
Yes, that's right.
And she spent a lot of time up here. Mm-hmm. We loved Margaret. Mm-hmm. Miss Pipkin.
That's right.
Well, that's sort of the. But anyway, I think Rick potentially, second to Dr. Willard, is the best dean.
I think that's how a lot of us feel. That there's a lot of really good potential, and he's certainly the right person for the job.
Well, if you look at the background, he is the only one who has been out in small town practice,
right.
except for Riley.
Right.
But Riley was an interim.
Interim dean.
Yeah.
Mm-hmm. Just for about a year.
Was that between Dr. Willard and Rowan?
Yes. Mm-hmm.
He held it down between those two, didn't he? Mm-hmm. Yeah, that's what I thought.
Right. Exactly.
So, Now he obviously he is, in case you don't remember, he practiced in his hometown of Tuskegee and in Enterprise.
That's right. That's right. So, okay. Yeah, we're excited about Dr. Striker too.
Yeah, I think he has the potential now. Things can change in a hurry. There was another one that I thought was going to do great wonders, and the bottom fell out for some reason. I don't know,
Okay.
but
yeah, I think people feel like Dr. Striker can continue to move the college.
I believe it. And what I'm seeing now is what he's doing with his study groups and this, that, and the other. You know.
Right.
Yeah, I recently became a, whatever you are, a board of visitors, you know.
That's right. That's right.
And I'm very pleased about it.
Good.
I really hadn't anticipated going back much. I just wanted to support him somehow.
Mm-hmm.
But with Mike being
Right.
on it and coming up, I'll probably go with him.
Yes, definitely.
This next one especially, he's going to give a good overview of where the college is now, both in terms of our programs, finances, everything. So
Good.
it's going to be a really good one to come to get a really good grasp on where we've been, where we are.
Oh,
sort of
great,
thing.
great.
Mm-hmm.
Well, you asked me if I'm pleased. The answer is yes.
Mm-hmm.
And I would have been pleased probably if Rick hadn't come back, but I'm really pleased with that.
Mm-hmm.
And but if you're talking about the national thing,
Right.
get back to we're just now learning to appreciate the primary care doctor.
Mm-hmm.
Now, somewhere in here, I wrote how it was way back when, and I said I might live long enough to see it come full circle.
Right.
And I think I'm about to get there.
Mm-hmm. Mm-hmm.
Yeah.
You all didn't eat up much of our food, and you didn't drink up much of our...
Well, I'll certainly grab something before we go.
Okay.
I'm going to go ahead and...
Okay.